Hey guys, my name is Ben, I'm that PT guy, and today I want to take a look at knee osteoarthritis. I want to go over some signs and symptoms and some treatment options for this disorder. So let's go ahead and dive right in. First, let's talk about the prevalence of this disorder. This is a very common abnormality that we see here in the United States, in North America, and I'm sure all over the world it's the same story. In fact, in North America, there are over 20 million individuals that deal with knee arthritis every year. Of that population, individuals that are 45 to 64 years old, about 25 to 30% will have knee pain from osteoarthritis. Now, in individuals over 65, that jumps up to almost 90% of the population. And so almost everybody over the age of 65, you could say, has knee osteoarthritis occurring. Many of these individuals have knee pain. And so what can we do about it? Well, that's one thing that I want to talk about later in this video. One thing to note is that females are twice as likely as male to have these degenerative processes in the knee. It is the second most common diagnosis after chronic heart disease, and so that is significant. It affects a wide spectrum of the population. It is very expensive in the United States. Prevention, surgeries, loss of work, all of these things are very costly, and so this is a large issue that we see. I think it's important to define what osteoarthritis actually is. In simple terms, it's a loss of the articular cartilage in the knee. Now, articular cartilage is this kind of dense material that allows for cushion, but more than even adding some cushion and shock absorption, it is there to allow that knee joint to move buttery smooth. In fact, it allows for 15 times less friction than ice at the knee joint. And so it is extremely smooth. It allows that knee joint to glide effortlessly as we bend and straighten out our knee. And so articular cartilage is extremely important when it comes to the biomechanics that we see with our knee joint. Cartilage does not have the ability to repair itself like our muscular tissue and our bony tissue. It's considered avascular, and so it really does not have the blood supply and the means to repair itself. So without the ability to repair itself, over time, the degeneration is going to lead to bone spurs, bone cysts. We're going to see wearing away of the bone. We may even see bone on bone at some point if the articular cartilage has been worn away to the point where there's none left. All of these can lead to significant pain, swelling, redness, tenderness in the knee, and it actually can change our body mechanics to even how we walk. And so people that have knee osteoarthritis, you're going to probably observe them walking differently. This may cause pain in the hip, the back, even down into the foot. And so many times these individuals have pain elsewhere that's referred from these shifts in the knee from the osteoarthritis and the pain that it has caused. Now, why does this happen in the knee joint so much? I think it's helpful to take a look at what the knee joint does. The knee joint is this buttress between the hip and the ankle joint. The hip is the powerhouse of our lower extremities. It is the driving force that allows us to walk, run, to step, to go upstairs, and so there's a lot of power there. The ankle joint in the foot, it's that adaptive component that allows us to adapt to our terrain as we walk, jog, step, hike, all of the fun things that we like to do. And so being that in-between component between these two joints, I think lends itself to these degenerative processes over time. What are some signs and symptoms? Well, joint pain obviously is a big one. Loss of motion is another. Swelling, popping, or what we call crepitus are other signs and symptoms that these individuals will have. And so all of these are going to lead to a decline in function. Usually these people have difficulty with their activities of daily living. Some of them, it progresses to the point where they no longer participate in their recreational activities such as golfing, basketball, other sports, playing with grandkids. All of these things become limited from the pain that osteoarthritis can cause. So what are some risks to knee arthritis? Well, previous injuries are actually going to be a big factor on how early these symptoms occur for some individuals. Many people were very active in their younger years playing different recreational sports. Injuries over time are going to just lead to a degeneration where the injury occurred over time. Some people are born with different abnormalities in their knee joint that they just cannot help. And so people that have different abnormalities in the knee joint that aren't considered normal by the wide population are probably at a higher risk to develop these arthritises, and many times they're looking at surgery to correct these issues. Other things like weight, diet, being sedentary, all of these other factors are going to lead to a higher risk of osteoarthritis as well. Let's talk about some knee joint loads. And I think that these are very interesting. Walking on a level surface, that is going to be almost 3.5 times the individual's body weight on the knee joint. Walking upstairs, you're almost at 5 times the individual's body weight that the knee joint is going to absorb. Running, 8 to 10 times the body weight of that individual. Jumping jumps up to almost 20 times the individual's body weight. And so you can see over time, the knee joint is taking a lot of shock. It's taking a lot of absorption from the activities that we do every day. And so over time, this just leads to degeneration of that cartilage in our knees. So let's talk about treatments. There are some different treatment options out there. Some are medications, some of it's nutrition. Weight control is a big one. Strengthening the legs, flexibility of certain muscle groups in the knee can help. Some type of orthotics have been shown to be beneficial with helping with knee joint pain from arthritis. Bracing can also be beneficial. And then ultimately, if you're in the rehab world like me, you see people after they have come through surgery. So let's take a look at some of these treatment options. So glucosamine chondroitin sulfate, these benefits take about a month to start to manifest. Overall, though, they're kind of poorly documented results. Most of the people that I have seen have not had a lot of success with these supplements. Hyaluronic acid, it has been shown to slow degeneration, reduce pain, and smooth the joint motion. Pain relief for these individuals are about 3 months after the injection, and I think there's a little bit better treatment with the hyaluronic acid than the glucosamine. And then, of course, if you're a physical therapist like I am, you're going to see people who get their 3-month corticosteroid injection. They will stop doing these after a while, and then you'll see these individuals back after surgery, usually total knee surgery. Which brings us to the surgical side of the treatment. So they may go in first and debride the knee, which is just cleaning out some of the worn away structures from the arthritis. You may see an Oates procedure. I don't see a lot of those just for degeneration. I have seen a few of these for individuals that have had traumatic injuries to their knees, typically in the younger population. You may see high tibial osteotomy. Again, a younger, more active population. Don't see very many of these in the older population. You may see a unicompartmental knee arthroplasty. I have seen a few of these, but not very many. The nice thing about the unicompartmental knee arthroplasty is that they typically are quicker rehabs, less pain, less swelling. They are able to bounce back, but typically these are just buying time until you get to the total knee arthroplasty. These are a much more involved surgery. In fact, you're looking at 6 to 12 months of full recovery after a total knee surgery. All right, so we talked about what osteoarthritis is. We talked about some signs and symptoms of osteoarthritis, and we talked about some interventions. If you liked what you saw, I have another video about talking about total knee arthroplasty and what you can expect after rehab. If you're looking at having that surgery, I highly suggest that you take a look at that video. Thanks so much for watching.